going to give you some few tips on how to control your blood pressure with yoga. So blood pressure, why are we talking today on that is, blood pressure is one of the non-communicable disease, which is in fact causing most of our stroke, heart attack and death in many individuals. So this hypertension, unless until you measure your BP, you may not be able to pick up. And when the blood pressure is above 120/80, it is called hypertension, that is high BP. So this is one of the major impact on our routine activities, because both rural and urban, we have a major portion of patients with hypertension, among which very few are under control and most of the people are not under control with their hypertension. Come to know what to do for hypertension, you have to know why hypertension is occurring. One is non-modifiable risk factor and modifiable risk factor, with which you come under the classification of hypertension or not. So non-modifiable risk factor is usually your age, which you cannot control and we have no control on it. And number two is your environment and the surrounding where you are. And these two cannot be modified at all. But modifiable risk factors are your weight, your obesity, your inactivity, physical inactivity, lack of exercise, your stress level, your smoking habit, your alcohol. And these modifiable risk factors are under your control, with which you can either have hypertension or prevent or escape from hypertension. And all this comes under lifestyle changes. So when you do have a good lifestyle change for your routine activities, definitely you will be prevented from getting hypertension in future. So what are these lifestyle changes? Number one is physical activity. It can be either exercise, swimming. It needn't be only a gym activity, and it can be either yoga, by which you can control not only your physical activity like your muscular or skeletal activity, but also your mind, the body together can be controlled with yoga. And that is very important to control your blood pressure, not only blood pressure, but to avoid getting major vascular events like a stroke or a heart attack or a diabetes also. So this yoga not only helps you to keep yourself active, this prevents you from getting many diseases. So that is very important role of yoga. And this correlates your breathing pattern, your meditation pattern, and your physical activity like a muscular activity. And all needn't push yourself to do a post which others do, where you see in most of your social medias. But you have to first consult your doctor whether your body is fit to do a yoga. And if you're not able to do all those kind of poses, still pranayama itself will help you to give a better stress management, better stress control, thereby controlling your blood pressure and other diseases. So stress is an important role where you get a lot of diseases, and specifically yoga controls this along with meditation. And what does yoga do actually? It has been scientifically proven that yoga definitely helps you to control your blood pressure at least 6 to 10 millimeter of mercury. So yoga affects your thalamus, your hypothalamus, where your vasomotor center is located, which has control on your blood pressure and heart rate. And when your body and mind together are under control of yourself, then naturally your heart rate, your blood pressure, all comes under control. So this improves your well-being, improves the quality of your life. And I may not suggest you wrongly that yoga alone can control your blood pressure, but definitely yoga will have a major impact on your blood pressure control. And in fact, if you are doing along with your diet modification, your habitual modification, along with yoga, that is a stress management with physical activity, definitely I can assure you, you can or you may be having a very minimal dosage of medicines, along with which you can get your BP under control. But otherwise, if you're not doing this, naturally your number of drugs may go up and the number of pills you're consuming may go up. And yoga experts recommend certain poses for reducing your blood pressure. And in yoga, all movements are slow. So you don't push yourself. You go according to your yoga instructor, according to them. And before that, have a consultation with your doctor whether you can do it. And the common yogas which can be used is, one is Ardha Halasana, Ardha Pava Mukshana, Bhujangasana, Makarasana, Pakshi Asana, Vakrasana, Parvadasana, Chakrasana, or few asanas which you can do to reduce your blood pressure, not only blood pressure, your stress management as such. If you're not able to do anything, any one of this, don't worry, just do pranayama, which controls your breathing and your mind, and naturally you will have your stress under control. Be aware that some standing poses, back bends and inversion should possibly be avoided if you have hypertension, and check with your doctor before starting yoga. Talk with your instructor and find out which is safe for you. I once again thank you all for patiently listening, and I wish all have a healthy life without hypertension. Thank you.